Morning. My name is Georgia Hunter, and I will be covering the case study for stroke and explaining the pathogenesis causing clinical manifestations which Mr. Marks has presented in this case study. A stroke occurs when there is a loss of blood flow to a part of the brain. This means your brain cells cannot obtain the oxygen and nutrients they need from blood in order to function, resulting in cerebral ischemia. Ischemia causes the cells in the brain to be deprived of adequate oxygen supply. This is known as cell hypoxia. Lack of blood supply to the brain also causes depletion of cellular androsterone triphosphate, ATP. ATP is a molecule that carries energy within cells, and without ATP, there is no longer energy to maintain the ionic gradients across the cell membrane. Energy failure at a cellular level leads to loss in cells' ion homeostasis, acidosis, an influx of sodium and calcium ions, passive inflow of water into the cells, and a disruption of the blood-brain barrier. Within a few minutes of cerebral ischemia, the core of the brain tissue affected by most dramatic blood flow reduction subsequently undergoes necrotic cell death within minutes, known as the ischemic core. The area surrounding the ischemic core is known as the penumbra. This space indicates cells having reduced blood flow and is salvageable for several hours with treatment. Necrotic cell death is characterized by initial cellular organelle swelling, causing the disintegration of nuclear structure and extrusion of cell contents into the extracellular space. Mr. Marks presenting to emergency with a Glasgow Coma scale of 11 out of 15 indicates the depth and duration of impaired consciousness and extent of impaired blood flow to the brain. With the Glasgow Coma scale of 3, aspects of the behavior are independently measured. Best eye response. This indicates whether arousal mechanisms in the brainstem are active. In Mr. Marks' case study, eyes are only open to speech, and therefore arousal mechanism is compromised, but Mr. Marks is still conscious. Voice is the best verbal response, indicating the recovery of consciousness and the area affected by cerebral ischemia. In Mr. Marks' case, score of 2, sounds but no words, indicates clinical diagnosis for aphasia. Aphasia is diagnosed and treated mainly by damage sustained to the primary affected region of the brain. In Mr. Marks' diagnosis, the inferior frontal lobe, responsible for language expression, known as Broca's area, has experienced the primary damage. This is also seen by the assessment of Glasgow Coma scale voice, sounds but no words, and agraphia, ability to write and express language. This damage has occurred as a result of cerebral ischemia, causing a breakdown between Mr. Marks' thoughts and language abilities. In contrast to this, Wernicke's area is mostly responsible for language comprehension, indicating the areas of the brain is less affected, as Mr. Marks received the best score for obeying commands. This score indicates that Mr. Marks can receive language better than he can express language. The best motor response is associated with central nervous functioning and site of affected cerebral ischemia. Mr. Marks' best motor response would be 6, as indicated by his left side, not his right side. 3 main types of strokes include ischemia, embolic and thrombotic, and hemorrhagic. An embolic stroke occurs due to clots formed in the arteria due to an underlying medical condition such as arterial fibrillation, deep vein thrombosis, or anterior ventricular septal defect. Blood clots are formed elsewhere in the body, such as the heart, and travel through the bloodstream to the brain, lodging in an artery, subsequently blocking blood flow to the brain. Thrombolic strokes are caused by a blood clot or a thrombosis that develops in the arteries supplying blood to the brain. Clots are usually formed due to high cholesterol buildup and fat lipids inside the blood vessels, as you can see here in this image. Approximately 2/3 of strokes are thrombolic strokes. Mr. Marks has a diagnosis of left middle cerebral artery ischemic stroke, MCA. This occurs when the middle cerebral artery usually becomes blocked by a blood clot that traveled from elsewhere in the body, an embolism. The blood clot most likely comes from the heart or the carotid artery, traveling through the bloodstream and the clot lodging in the middle cerebral artery. Mr. Marks' previous medical history and hypertension age 65 plus, are risk factors in contributing to the overall clinical presentation of Mr. Marks. Mr. Mark presents with clinical manifestations including severe right hemiplegia or severe weakness to the right side of the body, right-sided facial droop, and right hemipnea, a partial blindness or loss of sight in half your visual field. Anatomically, the brain's body hemisphere controls the right side of your body. This is because of the crossing over of the upper motor neurons along their course from the brain to the muscles just before the medulla oblongata and at the spinal cord. This is called desiccation. Hemophilia in Mr. Mark's visual field has occurred due to an insufficient supply of oxygen to the brain due to an embolus blockage limiting blood supply to the brain. Part of the brain responsible for eyesight is the occipital lobe. Other contributing factors include inflammation on the brain and age. Severe right hemiplegia and right-sided facial droop occur after the brain has reduced blood flow, oxygen, and energy vital to surviving. Therefore, neural inputs are reduced, resulting in muscle weakness and muscle contractures increases. Mr. Mark's diagnosis of left ischemic stroke indicates that the stroke occurred in the left hemisphere of the brain, having presented clinical manifestations, the impaired motor function being contralateral to the body. This occurs because the stroke at a cellular level, decreased oxygen supply causes subsequent neuron synapses and myelinated fibers death. These motor function deficits and muscular weakness symptoms are caused by the destruction of motor neurons and impaired motor impulses sent from the brain through the pyramidal pathway. The pyramidal pathway consists of nerve fibers from the brain that pass through the spinal cord to the motor cells, producing coordinated movement. Because anatomically, this pathway crosses at the medulla oblongata located in the brainstem, Mr. Mark's diagnosis of left ischemic stroke indicates the stroke occurred in the left hemisphere of the brain and therefore affected motor function contralateral to the body or on the right side. This can be seen through the clinical manifestations of a right side facial droop and severe right hemiplegia. I would like to conclude my presentation by summarizing some of the key points on clinical manifestations in relation to this case study. Stroke is a medical emergency, and acting fast to administer treatment is important for Mr. Mark's best recovery. It is important as a registered nurse that we can identify parts of the brain affected by stroke so that we can treat the patient and advocate for Mr. Marks. Associated clinical manifestations related to the pathophysiology of stroke include disruption of central motor pathways, such as the pyramidal pathway, affecting Mr. Mark's body contralateral to the affected brain's hemisphere. Cerebral ischemia in the left hemisphere of the brain, affecting language expression. This allows us as registered nurses to consolidate knowledge and inform the medical practitioners to provide best care of Mr. Marks. Thank you so much for watching. I hope you have a great day.